I'm now joined by BC Finance Minister Kevin Falcon. Minister, thank you for joining me.
Thanks for having me, Tim.
First off, I wanted to ask you, do you agree with this assessment that people have said this is the toughest budget in 30 years?
Well, I agree it's a tough budget in the sense that we're not throwing a lot of money around, but nor do I think we want to do that in the context of what's going on around the world. I mean, we have lots of examples in everywhere we look of governments that have lost discipline, lost control of spending, and they get themselves into a situation where they cannot protect public services like we are, like health and education, and they're having to slash. We don't want to be in that position.
Now, one of the areas that is not being cut is healthcare, but healthcare in BC has gone up typically about 6% in the last number of years, more than a decade, 6% a year. You are cutting that. You're cutting it down to about 2.8%. So are you setting people up for, British Columbians up for, longer waits or hallway medicine because the increases simply aren't going to be there?
No, actually what we've done is we've done some major innovations that are leading the country that have allowed us to bend down the growth in healthcare. In fact, this budget we actually underspent, we will underspend by about $111 million. That speaks to the success we've had uniquely in Canada on introducing changes like joint procurement, for example, that's saving $200 million in the health sector, like back office consolidation so we eliminate duplication. These are the kind of things that governments have to be upfront with the public. We've got to drive that kind of reform and innovation agenda so that we can bring down that growth curve in healthcare, because if we don't, we're going to have kids that are going to grow up and a system won't be there for them because we will have spent ourselves into the poorhouse.
Now, when you freeze budgets, though, for 3 years in a row, that eventually becomes a cut. I mean, inflation keeps going up, costs keep going up, and if the budgets are frozen, they're going to have to find that money. When you do that in a ministry like the Children's Ministry, is that not going to have an effect, a serious effect on vulnerable children?
Well, no, you have to remember that we're not asking ministries to just do everything the same way they've always done them. We are asking ministries to look at how they deliver programs and continue to strive to innovate, to try and see how we can do things better and smarter and try and deliver better outcomes. I think we have to focus on outcomes. We've got the best health system we were talking about, for example, in the country in almost every measurement. And yet it's not the most expensive in the country. In fact, we're the second lowest per capita funding, but we get the best outcomes. That's what we need to focus on, not how much we're pouring into the system, but what outcomes we're getting. We always have to strive to improve.
But just finally, innovation, I understand all that, but are you suggesting this is a budget that is going to be without pain? I mean, this seems like it's going to have a lot of pain over the next 3 years for British Columbians.
Well, if you want to see pain, look at what's happening in jurisdictions that have not had this kind of discipline. We're able to add $1.5 billion more in the health budget over the next 3 years. We're still able to add $165 million into education to support teachers and classroom composition. We're able to add funding into justice. We're able to add funding into social development to look after the most vulnerable in our society. But we're doing it in the context of an overall discipline of 2% budget expenditure growth over the next 3 years each year. And I think that's the responsible thing given the world we live in today.
Minister, thank you very much for joining us. I really appreciate it.